with the professional person. Another thing, like it is called negative change in emotional reaction. What is mean? Like or intensity memory or physical reaction related to traumatic event. Sometimes when person scared from dog because he has the event in his mind when he was a child, could be if the dog bite him or bite anyone of his family, or he when he walk in the street, he found since the accident happened. So when he sees the dog, any dog in the street, he will come to him. Or when you know somebody, or like another example, the best in our field to give a little example. Like one of my patients, what I told you about, she's smart. I asked her to apply for her for professional job, like as she was working before in lab in something, because she's really smart and she has the two measure. She said, no, I don't need. And she prepared. She was making at her time when she was so professional, she make it more than 100,000 a year. Okay, now she work in supermarket and she make 11 per hour. Like it's almost like maybe 20 or 50 or I don't know how many per a year, and she work part time. Instead, she was work full time, and she's looking like hold is a company. It is a medication company. It was built. It tried to build. It was at her time. It was she building the company to medication company. Now she can. She has a schizophrenia, PTSD, and or she has a PTSD, and there are by like something there are diagnosed her by schizophrenia, but she said exactly she has PTSD. In children, it's different. If child he gets any abusing, sexual abuse from anyone who's older, could be I'm sorry to say uncle, aunt, teacher, somebody in the street. When he saw him, he will get away from him. He didn't get attached. If he refused to say hi to any person, just accepted him. Don't pushing him to say hi or to kiss him or to hug him. Because this is type of our culture. Say hi, him. But if he refused and is scared, don't pushing him and she put it like question marker in your mind to ask your son children between you and them nicely what is going on, why you not love the person or see the lady or see the teacher, what is happened. Let me know. I am here for you to help you. I'm not judging you. I'm never judging you. I'm just I come in to help you. So it is always different. Could be big boy, could be big friend, could be somebody who all of us we see him who's so nice and so kind. But for your son or for your daughter, it is looking bad. She's not feeling comfortable with him or with her. It is always different depend with who you are seeking the treatment. What I mean, if sometimes when you are get PTSD, post traumatic disorder, and you isolated yourself and you keep yourself away and you don't want to go outside, you didn't want to see like you feeling sad and increases the sadness inside you or increases the isolating inside you, could make another disorder depression. And from depression, if you couldn't sleep at night and you have a nightmare or at all you didn't sleep, you will hear voices. Is all of them, all the mental disorder, it is related together. You will hear voices and you will scared or anything, any something like this. So it is the first thing you have to check your safety and stability. What do you mean safety and stability? You have to check or to to, to somebody who's you or to trust him and he has the knowledge enough to if he doesn't know or she doesn't know what is going on, but she can contact you with somebody who can helping you, somebody who can provide the appropriate treatment or contact you with anyone, be a bridge for you. Stability is near like it depends on the psychologist. I mean, it is you have to know you are in your house or you are in safe place and no one of who bothering you around you or who will be bothering you. This is the first thing. And also you have build support is mean friend, friends or husband or wife or anyone who can helping you to touch you. Maybe could be teacher. You are to trust him in school and college or professor who you are to trust him so he can attach you with somebody who's more professional. Yes, it is type of intensity of PTSD symptoms. Intensity of PTSD symptoms are depending on the person stressed when or she remembers the traumatic event treatment. It is mean since it is mean like how much you are since the situation when you are remembered is make you stress and get an anxiety. How much sometimes if the situation is easy or anything, you will come in slowly like oh yeah I don't need to go to the place so I will go another place. Sometimes if it is really hard, that situation happened and you keep it inside you and you try to dealing by yourself, but you couldn't and you didn't want and you didn't seek for help, will be increased the symptoms and your fear and your anxiety and your depression. So this is coming from says, I say, no, I can handle it by myself. At the same time, I isolated myself in my home. At the same time, I don't need to speak with anyone about the problem. That's the good things of us as a Muslims. We are seeking to increase our strength, our relationship with Allah. This is the best thing for us. When I'm treating anyone with any depression or any type of mental disorder, the first thing I try to attach it or strengthen his relationship with whatever his belief with it. But subhanallah, because the other type is not like us. Like when you, if somebody in different religion she is like scared. She's a different religion, and her dad is different religion from her, and of different type of Christianity. And she know her dad. This is what she believed in. Her dad will go to hell, and she will go to heaven. Okay, but we have Allah. Allah is a mercy. When I speak to somebody and he's so scared about his sin, about what he's doing in the past, will he go or where the person will go? I can tell him easily, Allah is a mercy. Be like, calm down. We're not like this. Allah, when you treat you with your mental illness, He knows what is going on inside you more than anyone, without any judgment. But there are different things. It's always like, it's always the person, like, I have person who's devil worship. He's worship for the devil. And all his tattoo in his face and his body about blood, about death, about something bad, something scary, and he's doing. At the same time, when you speak to him, subhanAllah, he's kind. And he's so upset about what is going on in Gaza, and he's so sad, feeling sad about the woman and children who die for food. At the same time, he's told me, everyone charge, like everyone charge me, like what you mean, like judge me, how is I'm looking, why I'm looking like this, why I'm doing what is that do about my religion, about everything. This is the type of PTSD. He, or in the beginning, his parents was abusing him. His mom, she didn't care about him. She's a different type of another problems, and no one supporting him until he get using, like he get involved in more in type of is not a treatment, is like a pain relief, and he's increased his symptoms by since the pain relief is not pain relief, it is like drugs, alcohol, also the things increase any mental illness symptoms or any mental illness symptoms. Subhanallah, in Islam, we can't. In Islam, we are scared to drink because Allah is forbidden for us, prevent us to drink. In Islam, if you have any side problem, you can just go to pray or astaghfirullah al-azim. Yeah, it is could be help you, depends the situation. But in Islam, Allah like told you you have to seek Him, plus to use the strength your relationship with Allah. For him, he doesn't know. Like, will he go for the devil or for his parents or for himself? He doesn't know. So this kind of another very bad, cause many problems in his life. And we can't, we try to resolve it problem one by one. Drugs and alcohol, and schizophrenia because it's coming from drugs and alcohol and medication. And after says we try to see like abusing, could be sexual abuse from his parents, could be anything else from his anyone. And when we keep insist any problems inside us, we not resolve it, will be cause PTSD. There are very important. You have to check yourself what I mean. If you are feeling sad and deep sad in dark situation, you stop to eat, you stop to drink, you stop to sleep, and you isolated yourself in your room. You didn't need to do anything. You prevent to do anything. You have to ask for help, because after sales, where you get another step of crisis. And as you, Allah, like ask us when to be sick, you have to seek for medication and treatment from professional place. You can go to hospital to tell them you are feeling sad and you are so upset and I need daily medication. I need to stay here or I will do something bad for myself. This could be happen. It is enough for the hospital or for professional to tell them you are crying all the day. You can't stop. Will keeping to give you medication is a better 100 times better than to do anything for yourself, like suicidal or to do or to hurt anyone else is a better 100%. Allah will be like forgive you and help you when you're seeking for help. Don't like isolate it yourself and you say, "Oh, no one will be help me. No one will be understand. No one will be feeling what I am feeling. No one will be supporting me." No, when you go to real professional, real somebody in the field, like if you want to buy house, you will go to anyone in the street, told him, I want to go buy a house, or you go to professional place who's selling the houses and who provides the loan with the lower interest or without interest, and you started to get the process. Says what you should to do. You have to go to right place and to express your feeling, whatever you are feeling, and start to do it. There are another things like it's really important to check the medication. If there are give you medication, any type of medication, they could be it is a medication cause you be depressed or feeling sad or prevent you to eat because the medication or most of the medication or all the medication, if not most, uh, will be have really bad side effects in your in your brain, in your body, will prevent you to dealing normal your life. Like I will let you. We, subhanallah, vitamin D3, it always the psychiatric provide vitamin D3. It is really important for your mood and your body and your brain. Vitamin D. There are a magnesium if you are stressed already and you are stressed and you don't know what is going on. Could be your body need magnesium. Anyway, before you take in any type of vitamins, ask your family doctor about this. To take it or no? To use it for yourself will be good or no? Is there taking any medication will be work against the vitamin or the vitamin will work against your body? This is the important things. Always when I have my patient has any type of mental illness and anxiety, depression, I told her, what about to drink hot cup of mint tea? Mint tea is a mint in mint, green mint, and put it in boiling water and covering the boiling water and drink it at night. Lily is stress free, like you will be treated from the stress and anxiety. Also, chamomile tea. We say babonic tea. It is like anything in chamomile. It is the flower in. It is like a tea in any place. You can buy it and you drink it at a night. It is really important to use the thing. Another type is really easy. When you come stressed and you find that you're stressed, you're anxiety, you're sad, you anger, it's reflected in your family, in yourself. Could be you have to sit down in the floor and attach your leg in the floor and you say, close your eyes. Imagine yourself in place you are love with the people or the person. The important be quiet. Try to be quiet around you as much as you can, and take deep breaths, but slowly, not like this, but slowly. And keep inside your stomach little bit, and exhale slowly. Do it many times before your reaction anything will be helped too until you found the appropriate treatment, the appropriate help. Never ever, like when you found yourself like this in depression or anxiety or have any bad event, just to delay. What I mean delay, like I ignored the feeling and leave the feeling until it is coming more and more and more and put it you in any bad suicidal thoughts or you can't sleep or homicidal, like you have thoughts about or yourself inside you talking to you to hurt yourself or anyone. And when you feel like, even if your son or your daughter or your dad or anyone, you see him, he's acting weird, like with an anxiety, just told him, I am here to help you. Let me help you. What is going on nicely between you and him until to find the appropriate place.
So, like, let's say we recognize that we're having a problem, right? Do we have to go directly to the hospital, or we can just seek a professional and tell them what's happening, and then do we have to go on medications right away, or there's like a process for treatment?
This is a very good question. Okay. First, depend. You have it is could be problems like it depends on the problems because everyone he has like a problem. It is different. It is better to go to hospital if you have suicidal thoughts. Okay. If you know somebody in therapist, mental health therapist, and he's like in the same your language, religion, will be better more than any other. Also, the medication, what he's doing, if you are or your parents or with somebody who love you and take care of you, and he can watch you as a side effect of the medication in you, because could be you taking something for depression and it is easy depression, and this is the something give you another side effect so bad. I'm not I'm not saying don't take in medication. Medication is really important. But if you are between somebody who's love you, he can tell you stop. You have to go to doctor. You have this side effect in you. You have to doctor to make a change. And the best things here, if you say I don't need to take the medication, they will not give you. Since the medication give me side effect, they will told you, okay, what about the another medication? But depends. Sometimes I have Muslim person and she was feeling like little bit depressed. And when she went to her family doctor provide for her CBD oil. She told her CBD oil is good, doesn't have the chemical type which make her addiction. Okay. I am a mental health therapist. I'm treating people who use marijuana, who use CBD oil. There has another difficult and so bad chemical inside the CBD, even if he doesn't have the chemical who makes the person addiction. Another type of chemical. This is from not from me, from person, from one of my patients who use the marijuana or CBD, who's told me I can't use it. CBD is has many like type of chemical together, mix it together to make the CBD, and this is really dangerous for my heart, for my body. And he started to explain what is the side effect. Anyway, says the person, she didn't refuse, she refused it. She come to me and I assessment her and I encouraged her to speak up to me. We will not disclose any information, we will not spread the information with anyone. And I didn't find it any crisis with her. I encouraged her to use magnesium is a vitamin, doesn't have any side effect in body, even if you take it more than usual, because it's always, I'm sorry, when you use the bathroom, with didn't stay inside your body. And I encouraged her to use chamomile tea, what is called the babonic tea. It is famous for us. If she can't sleeping, there are type of vitamins in everywhere. Natural vitamins help the person to sleep, to practice some exercise, to walk, to breathe correctly. Because if you're not breathing correctly, it will increase your like anxiety, depression, stress, all sorts of stuff, and you make problems in you. Like this is a bad, but if you come down, and breathe slowly. It's really different. It come down. You will find yourself, you already come down and you can understand it, everything what is told you. This is the one. There are type of medication I can't explore. Says the things could be good, could be bad, but just be careful around yourself. And yes, when you go to doctor, when you have to go to hospital direct, if you have suicidal thoughts, if you feeling you lost interest for the life, if you feeling you the life you don't doesn't have meaning for you. You didn't love anyone around you. You lost interest for you to be succeed or to be strong. So you have to go to hospital directly without any thinking. Like go if you can't sleep, if you're crying, and if you a bit told them like emergency room, if you have like heart or bad stomach ache or any bad or any accident, you go to emergency room and you told them what is going on with you and they keeping you. They will make for you assessment and the checkman and the check and they see if you really need to be inside for 2 days or 3 days. Could be three, could be depends on the situation. You will not stay for the hospital for rest of your life. Could be 3 days. Under just he will take the phone from you, the computer, the laptop for 3 days to let you get enough sleeping. And it is, when we say I want to what is called to wash my body, like inside me, like detox. I'm sorry. Yes. When I wanted to do detox, it will be mentally detox. It just keeping anything stress around you, who's making the stress or triggers for you away until to calm down. And after this, we'll start the assessment. See you if you really need medication or you need to speak or you need protection or whatever you are need. They will be help you. And if you have friend and she forcing you to go to hospital, something bad will be happen for hospital, don't let her your friend anymore because it's a bad advice.
So I have another question. A lot of people, they say, so a lot of people are saying, oh, I don't want to talk about my mental health issue, or they're scared of the stigma and how people will judge them, right? So what would you say to them if they think, they don't want to get the help because they're going to be judged?
That surprise you, everyone in the world has a mental illness. Everyone in the world, and especially the person, he say, I am 100% have a strong mental health. I don't need any help. Most of the people who's coming to told me and the rest in the treatment who says the things. Everyone could be PTSD, like from what is happening around the world, in different world. Could be depression. We are like a woman is always up down up down. Could be stress from the life needs, what you need, your children, your wife, your husband. Could be stress all says the same, even the behaviors, like we are treat people with the bad behavior, like I don't, the anger behavior, the bad thinking reflect in the behavior, or the person who's refused the treatment, or the person who's refused, he doesn't have any social relationship. What is mean socialization relationship? Like he doesn't have any friends, or she doesn't have any friends. She doesn't need any friends. This is a type of a mental illness or type of a behavior disorder. All the things is refract in your life. So it's like mental illness, like you when you are sometimes you wear glasses, some people wear glasses, some people um, had the back pain, uh, any disorder or any pain in your body. It's like this. you will be healing from the mental illness if you are use the correct treatment. You will be healing. Trust me. When I'm treating my patient, I told if you listen to me, after 6 months you will be okay. If you help me to help you, after 6 months you will be independent person and seeking for your future and you're doing the best for your life. If you're helping me to help you, because it's the people who come and say, most of the people what we are treating them who has a schizophrenia told me I'm good. I don't have any mental illness, guys. I told yes, I know. I'm God. He told me. You not believe me. No, I believe you are God. I know. This is a type of a mental disorder. I have patients who say themselves God. There are Jesus. There are porn gods. There are this is a type of a schizophrenia, religious mental, religious schizophrenia. So no, we have it's not shared. Like I'm not coming to the mosque or the youth or the school and say, hey guys, I have depression today. No, I'm not saying that. I'm not saying you will have to speak for anyone who has enough knowledge, who doesn't have any educate himself, or some people even there has a type of college type of education and they didn't believe with the mental illness. So when somebody he say like this or abusing you toward what you have from any type of illness, mental, body, any pain, don't engage with him in any conversation. Don't let him make you down. Just you have to stop for yourself, to say no, I will not let him know. Could be is not only mental illness. Could be when I come into you and speak to you about how is my feeling today, and you make a fun of my feeling and get tired from what I have, and you not respect my feeling, my emotional, my what I'm doing could be don't be why you go back again to make him your friend or to speak to him or to speak and this is the type of conflict relationship. So when you have mental illness or anything, don't be have a stigma to seek to the doctor or professional place and speak with them, and you could be very good resource, very good for anyone who's suffering from any problem like this. Yeah. And since the crisis step, you have to be to reach, as I said, for anyone of your family who you are to trust him. If you have any crisis is mean situation we can't handle it in home, we can't handle it in a school or in mosque or any religion place. You say crisis, that mean I'm start take away, like take a step toward the isolated, or I'm already isolated. I have suicidal thought. I have homicidal thoughts. So homicidal, like I wanted to hurt the family, or I wanted to do something for the community. I'm not love the community. I'm not love anyone, and I want to hurt it, the first thing you have to do it to tell the full person who you love how you are feeling, and you have to go to if he didn't know or realize or recognize what he has to do, go directly to hospital. Told them you will not go to jail, you will not go to prison, you will not nothing will be happen for you. It just will let you relax and give you the right medication. So this is the crisis. To this is what it means crisis. Reach out to monasteries person, like anyone in mosque could be, or in church or any place who's really know with this stuff. He's really know with the mental illness, and you to trust him. If he told you don't to go anywhere, just to go in your room or your house and keep your family close to you, and don't let anyone know, because if anyone will put it you will put yourself in trouble. No, listen to me, go to the hospital if he doesn't know what you have to do with. Okay? Since the societal hotline 988. There are help the people who have suicidal thoughts. If you are in school and you have a friend who's bothering you or bullying you and pushing you to do anything for yourself or doesn't like you have to speak for your teacher if she doesn't helping you, for your principal if doesn't help you or helping you, for your parents if they're no, you have to call um, the hotline or to call the police or to make a report like for them, but never ever or go to the social worker in school. The psychologists in school, they are so helpful there. Like I'm seeking for my daughter. My daughter one day she come and told me, my mom, I have friends who's doing like this in school, and he's like, I don't know, it is 10 years old. So says, what is mean? I called the school directly and I told the social worker, there, be careful, we have 1, 2, 3 in my daughter class, and please make sure that the person is really safe or that the child is really safe. So every science for us has a meaning. Don't take a joke with it. Every if sad symptoms like the crying without you can't know, he doesn't disclose it or she doesn't disclose it with you. Take into the social psychologist or social worker or for the family doctor to know what is going on. So since the TCAS or call 911. I don't know about TCAS. Call 911. We always call it them for them. I'm always for my patient all the time. If I found something in the street, I call 911. If I found fell down in a wire or an electric, I call 911. If anything's 911, I think my name is the phone for them. Thank you. Thank you for listening. I wish I helped you guys for anything.
Okay, so you said,
You said, like if someone comes to you for treatment, you tell them to give you 6 months. I think a lot of people expect like an immediate response, right? And an immediate turnaround. They've been going to counseling for 2 months and like I still feel horrible. I think, can you just talk to that point that it doesn't like things don't just happen overnight? Yeah.
So what I mean by 6 months, I mean by 6 months coming to me and I assessed you. I know what type of disorder you have. And our psychiatrist will give you the treatment if she needs. 6 months, you mean after 6 months, if you are like, do it what I tell you, you will be healing. You need immediately help. Immediately help is coming to change your thoughts and this is my work, to change your feeling and this is my work, to make you feeling better, this is my work. Immediately, the mental illness, like when if you have broken leg, you want immediately to leg coming back again and walk, or you will have to stay step by step and to check and to go to under the scan and to go X-ray and it's a type of broken you have, what type of medication you should be taking. So when you come into me and I told you, I mean mental illness should be not stay all the rest of your life or prevent you to do your normal dealing life, like work, routine life, work, care of your kids, to care of yourself. But if you live in yourself with the mental illness, will you prevent yourself to doing your life, to the routine of your life, care to marry, to have your career, to doing everything. This is what I mean. It's clear?
People expect to see results like this. And sometimes it takes time. It doesn't happen 2 weeks.
Or he will be the result like this.
Results like this. Stick with it, right? Like you have to make the change. You have to put the effort. It can't just happen tomorrow.
Exactly. If you have any pain in your body and you take pain relief, pain relief is a pain relief for immediately, like, and after pain relief is done, finish work in your body, will come back has the pain. That's right. The people who seek uh, relief from mental illness like this, who's the people who use drugs and use drugs to get to didn't feeling with the pain, to stop thinking God, to stop see the real life, the rest, what is going on around him, how he can help him. Sees the people who say, no, I want to heal, like feeling well like this. No, and they're coming after this, coming in that they cause problem for themselves, for their body, for their mental, with the medication who's taken, and he's get another type, many type of disorder. So you have to, like, if you found somebody, child, or somebody weak, and in a problem, what you will do? You try to support in him to check what is going on. Let me help you. What is I will supporting you. You need clothes. You need and you try to support and advocate him and to prevent any bad things from him to get to him. This is what you have to do regard for yourself. You have to check yourself. Why I'm so sad today? Did yesterday I was sad? Did before yesterday I was crying? Did I'm upset from everyone around me? I'm so anxious. I'm not like my work. So you have to take a break and calm down and to speak with somebody who can help you to let you know what type of thinking you have to think, how what you have to doing toward also the stress. It could be like I have like said the person who she think all her friend is walk forward towards the future, like, but she was the smartest one from them, but she's stuck in the past. She think about her she's not a Muslim, and she think about her boyfriend who's passed away, and she think about when how she can meet him, how she and she stopped to looking forward in her life. She doesn't want to get married. She doesn't want to know anyone. She doesn't want to work. She doesn't want to help herself. She just after every like 3 months, she go to hospital and she come back. Go to hospital and come back. When I went to my work, I told for my team, see the girl, her treatment to go to work. All of them say no, she can't work. She has a depression. I told, see the hair treatment. See the treatment could be is not only medication. Who's the person who's thinking right? Even if you can think right for yourself, maybe you're seeking for some person who think right for you, some person who you are to trust him and just love you. Could be your mom, could be your dad, could be your sister, could be your brother, your husband, could be your son or daughter, or closer friend who's really honest and she wants you to be good.
You know what I mean? And you have to tell them in the moment they gotta give themselves time because they started the problem within a month, right? Or they ignored their mental health for a month, 2, 3, 4, 5, 6, for years, right? So the expectation that when they go see a therapist or they go to the hospital or they take medication or the case might be, and they want it to be instant. Like you said, if you break a bone, it takes time to heal. So it's the same thing. If you have mental illness and it does, like, if you got to the crisis, it depends on the, how far it is going to take time, right? Because you stayed as long to recognize that I need help. So it's not going to be resolved once I go to a doctor and hey, like you're going to take a painkiller, you said, right? And you said the painkiller is going to relieve it just for now.
Yeah, yeah, I understand. I think I understand your point. I don't know.
No, I think you
I understand.
Like it takes time to heal. It takes time to good habits, new thinking patterns, new taking medication or taking vitamins, taking care of yourself.
Yes, and especially that the mental medication is take time until to work. It's not working like when you take it is working. but you can feeling after 1 week, 2 weeks with the changes. What you mean? I need immediately help. Is not my key. I don't have the key to let you stop to think bad about yourself or about your life. But I can't provide the supporting for you. Like I told you, don't watch the TV, don't watch the news. The news make you an anxiety and has a depression. Stop watching. This is my recommendation for my patient. All of them with every type of religion, with every type with the natural. I told them, stop watch TV. Don't watch TV. All of them lie. All of them lies. Any news lies. Don't trust anyone. You have to take a break from the TVs, from the news. And don't watch. If you want watching something in TV, watching something light, something comedy, something help you little relax. Not fight, not scary movie, not news, not anything. You mean is a healing from the mental illness depends when you are sick, you're seeking for the treatment. Could be you have mental illness from long time ago when you was a child, and with the time is grown and with another type of a mental illness and it change your personality and your behavior and everything. Could be now because you have enough education and you are brave to say, hey, I'm not thinking good. I think my mind has something wrong. I have to seek to doctor. Depends what you where you are seeking, how you are thinking. Actually, I have patient who she's a normal, she's a nice, and she has one day she said she come back from the work and she said, I'm not feeling good, something wrong. I'm not feeling elastic. My mind told me something is not real. I can't organize myself, and she went to a hospital. Okay, could be she taking medication and whose refractises in her brain, and she was taking like chemotherapy, something like this, and it changes the brain chemical. So yes, I mean 6 months. When you help me, to let me help you. 6 months. If you are prevent or resistant my helping you, I can't help you.
Anyone else have any questions? Do you have any questions? Girls, do you have any questions? You sure? Did you learn something today? You. Can you say this? Oh, that was good. You're welcome.